Mom, you're still in bed? It's like 3 o'clock. I have to go to soccer practice. You don't have to be so sad. It's okay.
You're listening to Parenting in the Rain, Insights from the Experts podcast, episode 33.
Welcome to Parenting in the Rain, Insights from the Experts podcast, providing parents all around the world with valuable knowledge to help with the biggies of family life. Here's your host, a registered play therapist, education specialist, parent coach, and my mom, Jackie Flynn.
Hi there, Jackie Flynn here. Thanks for tuning in to another episode of Parenting in the Rain podcast. At the time of this recording, it's early August. The kids are back in school, so we're kind of getting into a routine somewhat, but we still have a ways to go to get that ironed out. But it feels good to be back, and my son just started high school. My daughter just started middle school, so that's a whole different world of itself. Got a real nice email from one of my daughter's teachers. I'm excited this year for both of them. I think they're set up pretty well for school, so I'm wishing them the best, and I wish you and your family the best too. Well, today we're going to talk about parent depression. Parent depression is often a misunderstood condition. Actually, depression with anybody is often misunderstood. I think a lot of times that word gets thrown around a lot. So today we're going to talk about what it is and what it isn't, and what can help and what doesn't help. It's so much more than just being sad. So one thing that you may have heard of, that postpartum depression, that depression after having a baby, that can be really tough. There's a big stigma around that, where people kind of view it as like a character flaw or something that's wrong with them, and that's not the case at all. I know a lot of times the medical professionals, they'll check in, the medical team, after someone has a baby to see if those depressive symptoms are present. It's not uncommon, but it can leave people feeling guilty and shameful, and that can make it even worse. So what does help is lots of love and support for the mom and the baby. That's just vital during that time, but also seeking support from a mental health and a medical professional is really important too, because that's a really important time, especially during those first 3 months. That parent-child connection is a biggie. During the first 3 years, it's a biggie in terms of attachment, but that first 3 months too. So you want to make sure that if you do feel those depressive symptoms, that you just don't push them under the rug. Know that you really need to take care of yourself. You want to make sure you're there for yourself so that you can be there for others. I like that analogy of when you go on a flight and they tell you to put on your oxygen mask before you put it on your children. That's the case here too. If you're feeling those depressive symptoms, whether it's postpartum or any time of your parenting journey, making sure you take care of yourself. If you feel depressed, if you feel these things that we're going to talk about today, reach out for some mental health support. It can make a difference. I've seen it firsthand. And specifically about parenting, the parent-child relationship is so very important, especially in those first 3 years of life. But overall, it's important, during any time. But those first 3 years of life, there's a lot of brain development going on, and that connection really supports that. And that's when the attachment is formed, those early months and early years. And that's a biggie. Attachment really lays the blueprint for your child's brain for other relationships. So you want to make sure you set them up for success. And if you're feeling those depressed symptoms, it's hard to do that in a really strong way. Attachment is really, it's going to be an episode all in of itself. But I bring it up here to really emphasize the importance of seeking treatment if you're a parent, because if you're experiencing these symptoms of depression, it is so worth going and getting help. It can really affect your child's development and the way that they see the world, the way that they feel the world. reaching out for support from a qualified mental health professional. And that could look like a licensed social worker, licensed psychologist, licensed psychiatrist, licensed mental health counselor, which is what I am, and really kind of delving into what can help me, and looking at your resources can really make a difference in the life, in your life, in the lives of those who love you. It can allow your quality of life to just improve and help you and your child to just connect in a really meaningful way. And that's more than just warm and fuzzy. That goes on a whole other level too, of helping them develop in a healthy way. When children see their parents suffering, it can take a toll for sure. There's so many treatments for depression. As a mental health counselor, I help people with depression through therapy in my private practice. It's important to know that there's so many different types of therapy. I'm going to mention a few, but there's way more. There's cognitive behavioral therapy, that's CBT, and that really engages the frontal lobe of the brain, which can help you identify your thoughts. There's RE, more of the brain. It's more of a whole brain approach. It can really involve your limbic system and just really give you that a quicker, more rapid approach, more effective approach in some cases. And you can tell I have a preference towards this type of therapy because I've seen so many amazing things happen with EMDR therapy. Also, there's art therapy, and art can really get to where words can't go, and it can help give people insights and healing. I like art, expressive arts through sand tray and painting and things like that. Mindfulness is really good, especially for depression. My colleague Robert Cox, he has a podcast called Mindful Recovery. If you haven't listened to that yet, it's so worth listening to. He has a couple of activities where he will guide you, kind of like guided mindfulness activities, guide you through ways to help build that mindful muscle. That can really help with depression. Also, there's DBT, Dialectical Behavioral Therapy. I use that with my adolescent clients often, and people that sometimes engage in self-harm, but that can be used for many different ways too. But that depression can be a piece of those situations for sure. Solution-focused therapy. But there's so many types of therapy out there that it would be tough for me to name all of them here. But when you look for a therapist, if you do, and it's important that you really pick someone who you feel like can address your situation in a way that is really with confidence and competence, and really see if you relate to that person. A lot of research points to the biggest part of whether therapy works or not is that relationship. So you want to make sure that it's somebody that you feel comfortable with. And you could do that. A lot of therapists offer a free consultation because that relationship is so important. They want to make sure that they're a good fit for you and you're a good fit for them. So ask them if they have a free consultation. And if they don't, then you can always just kind of do your own research, or sometimes people go to a session and check it out. So really kind of you do as much research as you would as anything else that was important to you, because you want to make sure you pick somebody that's right for you. I prefer during therapy using that whole brain approach. So a lot of times I'll use EMDR, I'll use mindfulness, I'll use a little bit of the CBT, I'll do a little bit of everything in the same session. The art therapy is a biggie of mine. I'm really attuned to my clients. I don't go in there with a pre-plan of what we're going to do. I really kind of connect with them and see what they need. But oftentimes therapists will create a treatment plan, which is like a roadmap, trying to, so you're focused on the goals and you keep in the same direction. So that is really helpful as well. A lot of times on that treatment plan, it may look like the client will journal or exercise or join a group, something like that. Group therapy is helpful. Everybody's different though. What works for one person may not work for another. And it's not a matter of just giving you a list of things to do. The actual therapy is healing. The important thing is that you take action. Don't let it eat up these valuable parenting years. You don't get them back. It's so important to kind of realize the magnitude of, okay, I know this is so hard, but I'm going to reach out for support. I don't have to do this by myself, but I'm going to, because I'm going to get support, because I want to make sure these parenting years are just the best that they can possibly be. And it's tough, and I know sometimes it's even hard to get out of bed some days. Really, really kind of drags you down. It can feel like you're wearing cement blocks on your feet, just like, oh, I don't know if I could do this today. That's some big signs that you're feeling those depressive symptoms. Some people seek medication through a medical professional or psychiatrist to address their depression. Now, I just read the best book, The Body Keeps the Score. I actually have an Audible account, which has literally changed my life. I love listening to the books on Audible. And I've read 4 books so far, which is exciting. I read The Mindful Therapist. Oh, I just finished Brene Brown's Daring Greatly. Oh my goodness, is she wonderful. And then Bessel van der Kolk's book on The Body Keeps the Score. And that's the one that I'm getting ready to talk about in a second. And I just ordered another one. I haven't read it all the way, I guess, by Peter Levine. He's one of the experts on somatic things in the body, the way that you can really help people by helping them to be mindful of different things in their body. And he gives exercises in that book, which I'm excited. I'm listening to that too. I'm going to listen to it more on my way to work today. But in that book, The Body Keeps the Score, it is fantastic. But he really talks about how medication, his views on medication. I don't think medication's bad or good. I think that you really need to have a thorough look at your situation and really kind of delve into, I want to use that as an adjunct to therapy whenever it's absolutely necessary, because therapy, I believe, and this is a very controversial, everybody has a little bit of different opinion, sometimes a lot of a different opinion, but I think it should be used with caution. But sometimes it's necessary. Sometimes I've referred my clients to a psychiatrist to support that. Really, it dulls the emotions to the point to make therapy effective. And I think it's really important to not dull the emotions completely, because then you kind of dull your life. And when you stop taking the medicine, then the symptoms come back, and therapy can help you to heal from that. If not fully, it can, help you move towards a different space and provide coping skills, which is a biggie. So you want to make sure that you're kind of working towards that goal of healing from it, not just escaping from it. But I do want to be clear that sometimes I've seen it really helpful as an adjunct to therapy. Again, I'm not a medical professional. I'm a mental health professional, but I'm not a medical professional. So if that's something that you're interested in, be sure to speak with your physician or your psychiatrist about that to see what's best for you. And one thing that's important to know about depression is that it doesn't help to try to convince somebody the reasons why they should be happy. I wish it worked that way. It'd be so much easier, right? But when somebody's really experiencing depression, just telling them why they shouldn't be depressed can actually make it worse. It can make them feel more ashamed, depressed in a way that is deeper and more painful, and leave them feeling hopeless and kind of like, gosh, something's wrong with me, I'm defective. So you want to make sure you pull in closer, you give that understanding, that support, and that love, and really seek out for that mental health support. And it's also what I want to bring out, because I used to work with hospice here in my local vicinity, and I really got some great training and experience with people experiencing grief and loss. And that can really kind of lead to those depressive symptoms. That's different than, say, major depression that we're talking about here, or postpartum depression. That's something that's kind of seen as normal. So it's important to seek support and therapy during that, especially if it really becomes impactful on your life. At hospice, we had, or they have still, a support group that was amazing. That when you get in the presence of others, it can do just beautiful things for your heart. So let's really delve into let's talk about major depressive disorder, as in the DSM-5. Really, there's like a whole list of criteria, and I won't bore you with all the jargon or anything because it can sound pretty clinical. And the diagnostic manuals, the DSM-5, really, they have a whole list of things that could be part of major depressive disorder. I believe they have like 9. And when someone gets officially diagnosed with depression, they have like 5 or more of those symptoms that they've listed. So, and it has to be present during the same 2-week period. So really, there is an official diagnosis for it. I'm not a huge fan of diagnosis, especially after reading that book, because it kind of puts people in a box. But it does give a framework to help people by, and sometimes it's very necessary, especially for insurance reasons. They like the diagnosis. I'm definitely like treating the person, not necessarily from a list of things they should do, but what happens in session. But really just knowing what that is. So it could be depressed mood most of the day, nearly every day, feeling sad, empty, or hopeless. Just that lessened, diminished interest or pleasure in the activities that you used to really enjoy. Or it could be like a significant weight change, whether you lose or gain weight, insomnia. And then they have one like the restlessness, and then feeling tired, feeling worthless, the diminished ability to focus and concentrate. That's something that I've seen in almost every person that I've worked with that has experienced depression. That focus and concentration has been a biggie. And the reoccurrent thoughts of death could be a biggie too. Not just a fear of dying, but sometimes like suicidal ideation. And it doesn't have to necessarily be with a plan, but just the thoughts of it. So any of those things are definitely worth noting, but specifically the diagnosis of it be 5 or more of those things. And it can look so different, as you really get into it. They can really kind of narrow it down. Is it with anxiety or mixed features, mood changes? There's several different ones. And you can even be affected by the seasonal changes. So really kind of educating yourself on what you're feeling and how's that impacting your life. And if it is consistent with those depressive symptoms, just really checking in and saying, hey, what are my support options? That is so very important, especially if you're a parent, because when we parent, we need to be connected with our kiddos. We need to be present with our kiddos. And depression can leave us feeling so disconnected and so just tired and exhausted from everyday life that it can really make it tough to be a parent that's going to really help our kiddos develop in a healthy way. All right, thank you so much for listening to this episode. If you have any questions at all, please feel free to give me a shout out at Jackie at JackieFlynnConsulting.com, or you can go ahead and visit my Facebook group, Parenting in the Rain Community. It's a group, and I also have a page too. So I would love if you join that group. Just kind of pop in Facebook and search for Parenting in the Rain Community. And also, there's a page. You can like that. I would love to have you there. There's some really good folks. And I'm getting ready to launch something. I don't want to tell it just yet because I haven't got all the details out, but I'm really excited. So stay tuned for future episodes. And if you haven't done so yet and you're an iTunes user, make sure that you check us out on iTunes. Parenting in the Rain podcast. All right. Thank you so much for listening. And until next time, take care.